Hi, I'm Dr. Lori Marbus, a family doc from StrongFitBody.com, here with 5 simple suggestions or questions you need to ask your physician that can actually save your life. As a physician, I am very busy and so are you, and sometimes in an appointment we may forget to give some very important information or ask some simple questions that can actually affect your life. So please take what I'm asking you or telling you and ask your doctor what they can do for you. Number 1, do you have an updated list of medications, and do you bring your medications to each visit? Do you have specialists that also prescribe medications for you? Or perhaps you went to the ER over the last weekend and were given some new medications that actually might interact with the medications that you already are prescribed. The important thing for you to know is it's a very simple thing. Bring your medications with you. Everything that you're taking, bring it in a bag, give it to your doctor. Great. Leave that office with an updated list of medications. Take it with you with your diagnoses. Do you have heart disease? Do you have diabetes? Do you have asthma? Your allergies? So if you are ever sick or in a compromised position, there is some information that can actually save your life as well. Did you know 106,000 Americans die each year of the expected side effects of medications? That is 1 million people every 10 years in the United States. For me, that is unacceptable. So help me help you. Bring your medications to every appointment. Number 2, are your conditions under control? For example, if you have asthma, are you using your inhaler more than twice a month? If that's the case, your asthma is not well controlled. If I had a patient who spent the good portion of his 30 years using his inhaler 4 to 5, 6 times a day, when he came to see me, we discussed his asthma, his triggers, different things. We got his asthma under control, and he feels like a whole new wonderful world has opened up for him. If you have diabetes, are you checking your feet daily? Do you see your ophthalmologist every year for a diabetic eye exam? The number 1 cause of adult onset diabetes in the United States, or an adult onset blindness in the United States, is actually diabetes. So it's very important that you know what you need to be doing to keep your diabetes under control, your asthma under control, COPD, have you had vaccines? Are your medications up to date? Are there better medications that might be better prescribed for you? So make sure you ask your doctor, am I under the best control that I can possibly be, and what can I do to help myself? For example, COPD, do you still smoke? Number 1 thing you can do is stop smoking. There are medications, there are tools, there are behavior strategies that we can do to help you stop smoking. Number 3, preventive tests. These are as simple as, do you need a mammogram every year? My mom was diagnosed with breast cancer a few weeks ago. It's very, very important that you know if you need to be tested even earlier. Let's say you had a relative as a mother or a father or a sister or a brother who was diagnosed with colon cancer before the age of 50. You need to begin screening 10 years earlier than they were actually diagnosed. Tell your doctor your family history. That is a very important key to your future health awareness and what we can do for you. Do you need to have pap smears? There are new guidelines coming out all the time. Your doctor should be up to date on those. Ask them if you need to be having those done. In addition to that, are you up to date on your vaccines? Did you know if you have asthma, you should have had the pneumonia shot? If you're over 65, you should also have the pneumonia shot. Have you had the shingles? Are you up to date on your tetanus? A booster is required every 10 years. Did you get a simple thing as the flu vaccine? And I promise you cannot get the flu from getting the flu vaccine. So it's very important that you protect yourself. Make sure you know what you need to know, and ask your doctor about any questions you may have about your diagnoses or your medication. Last but not least, when should you go to the ER? It is so very important that if you have any of the following that I'm about to tell you, that you go straight to the ER. Do not wait for your doctor's appointment on Monday. You go straight to the ER. 1, do you have acute onset of chest pain, crushing, unable to breathe, feel faint, dizziness, slurred speech, paralysis on one side of the face or limb, feeling weak, sudden blindness on one side of the eye? Does it ever look like a shade was drawn over your eye and you can't open it? the worst headache of your life, severe abdominal pain, especially in that right lower side, that is where the appendix is located. Sustained fever, neck pain, and headache where it's rigid, where you can't bend your neck, that could be meningitis. Those items need to be seen in an ER immediately, and do not wait to be seen by your doctor the following week. Those are my 5 suggestions that could actually save your life, and thank you, and stay tuned in strongfitbody.com.